a mock interview performed by Carroll University nursing students containing fictitious data. Hello, my name is Charlotte. I'm going to be your nurse for today.
Hi, my name's Susan. Nice to meet you.
Likewise, Susan. Could you please confirm for me your name, age, and date of birth?
Sure. My name is Susan Carolyn Smith.
Okay.
I'm 42 and I was born August 23rd, 1973.
Okay, thank you very much. Could you please tell me the reason for your visit today?
Well, my husband and I have recently decided to start a family.
I see. Today I'm going to ask you a series of questions about your relationship, menstrual history, obstetrics, general history, and health history, if that's okay.
That's fine.
First off, do you take any medications regularly?
Nothing but my daily vitamin.
What kind of vitamins?
Well, I take B12, folic, and iron.
Okay, so moving on. Could you tell me a little bit about your husband and why you decided to start a family now?
Well, I met my husband on Match.com, and we're both previously divorced, and we've been single for a couple of years. And we both love scuba diving, so we decided to go on a date and give it a shot. Well, a couple of years later, he decided to pop the question, and I, of course, said yes, and the rest is history. Well, we've been married for a few years now, and I feel like we've been focusing on work way too much, the both of us. But we have a wonderful marriage, and my husband is very supportive of me and wants me to be happy. With time moving by so quickly, I really want to start a family and have a baby.
And does your husband feel the same way about having a baby?
No, my husband doesn't really feel the same.
Really? What do you mean by him not feeling the same?
He just feels that it's too late to start a family.
I'm sorry to hear that. I'm going to start by asking a little bit about your menstrual cycle. How old were you when you first began menstruating?
When I was 13, maybe?
Alright, and how many days does your period normally last?
Around 5.
Okay, and how long does your whole cycle last?
Around 28 days.
Alright, so your period lasts about 5 days, and your cycle is about 28 days. What part of your menstrual cycle would you be in now?
I'm currently on it, and it started about 2 days ago.
And do you use a vaginal douche?
Well, of course I would like to keep things fresh.
Do you use any feminine hygiene sprays?
No.
And how would you describe the flow of your period?
Not heavy, but not light either. Probably about average.
Alright, and have you ever experienced amenorrhea?
What is that? I don't know what that is.
I'm sorry. Have you ever experienced missing your periods or maybe a change in cycle?
Not that I've noticed. I'm fairly regular.
Is there any clotting during your period?
No.
And do you notice any bleeding between your menstrual cycles?
No, I don't.
Do you experience any episodes of flushing, chilling, or intolerance to temperature changes?
Well, I like it warm at my house, but no.
Okay. And as you have gotten older, have your periods stopped or slowed?
Not experiencing menopause, if that's what you're talking about.
I see. Do you have any pain or cramps during your period?
I used to when I was younger, but not since I started birth control.
Do you have any other symptoms? Bloating, breast tenderness, or moodiness during your period?
Well, my husband claims that I get needy during my cycle. And I mean before and after it, that is. But I always deny it. I don't think I've noticed any breast tenderness, but I have been a little bloated.
Okay. Do you have any unusual or increased vaginal discharge now or in the past, such as white, yellow, yellow-green, gray, curd, or foul smelling?
Nothing out of the ordinary.
And have you had any problems in the genital area, such as sores or lesions?
No, never.
Are you experiencing any abdominal pain?
I am not.
And have you had any past surgeries on your uterus, ovaries, or vagina?
I have not. It's all natural.
Oh, is there any family history of diabetes?
No.
Oh, I'm so sorry. I must have forgot to turn it off.
Oh, well, that's fine. Don't worry about it.
Let's see here. Where were we? Okay, right here. Do you have any problems urinating, for example? Do you go frequently, in small amounts, or can you not wait to urinate sometimes?
No, nothing of the sort that I can think of.
Do you experience any burning sensation or maybe pain during urination?
Nothing of the sort.
And do you have to urinate frequently, maybe during the night?
No, I usually go before bed and right when I wake up.
Okay. And have you ever noticed any blood in your urine besides during your period?
I have not. No.
Alright, and is your urine dark, cloudy, or foul smelling?
No.
Do you urinate while sneezing, laughing, or coughing?
No, not at all.
And how often do you go to the gynecologist for checkups?
Oh boy. Fairly regularly. I think maybe once a year.
Okay. Has your mother ever mentioned taking hormones while pregnant with you?
She's never mentioned any such thing to me.
Have you ever had a pap smear before?
Yes, I have.
Okay. And maybe do you remember the date and possibly the results?
I think it was around 2 years ago.
Okay.
And it was normal. I'm pretty sure.
Alright. Would you have any history of breast cancer in your family?
My grandmother did.
I'm sorry to hear that. Have you done a self-breast exam recently?
No, not for years.
Okay. You know, it is important to perform regular self-breast exams because people that have a family history of breast cancer, no natural children, or possibly having a child after the age of 30 are at higher risk of breast cancer. Do you remember how to perform a self-breast exam?
Don't you just kind of feel around?
Well, kinda. It's good to lie down with one arm behind your head. This will spread out the breast tissue evenly. Then, you can use the pads of your middle, index, and ring finger on the hand that's not under your head, and you can feel for any breast lumps by using circular motions.
Okay. And then what should I do if something seems abnormal?
Just make an appointment with your doctor, and she can check it for you.
Oh, okay.
Do you have any other questions?
Not at the moment, I don't think.
All right. So now I'm going to ask you a couple questions about your obstetrics or previous pregnancy history. Have you ever been pregnant?
I was when I was 26, yes.
All right. Could you tell me a little bit about the outcome of your pregnancy?
Well, I had a miscarriage, and that unfortunately ended my marriage to my first husband, Frank.
Could you tell me more about your miscarriage and Frank?
Okay. Well, where do I start? Well, I met Frank at a club when I was a senior in college, and I was 22 years old at the time, and I was just kind of looking to have some fun. We partied all night long, and I was actually shocked because Frank called me the next day. And we started dating, and it was great, and we were happy. And a few years later, we got married in Las Vegas. And then a couple of years down the road after that, we were having intercourse, and the condom broke. And at this point, I was 24. Okay, and I was newly married, and I was pregnant. And Frank was really excited with the baby, and so was I. And everything was great. But that's why it was so hard when I had the miscarriage. Frank was absolutely devastated, and he became depressed and resentful, and he started drinking an awful lot, and he just drank all the sorrows away. And a couple of months after the miscarriage, he asked me for a divorce, and while I was heartbroken, I knew it was the best for the both of us.
I'm so sorry to hear that. Do you have any other sexual partners right now besides your current husband?
No.
And do you have any history of sexual abuse?
No, nothing like that.
Well, I'm glad to hear that. So we're going to move on. Is there any chance you could be pregnant right now?
I doubt it because my husband does not want me to stop taking birth control.
Okay. Do you mind if I ask you a couple of questions about birth control?
No, not at all.
So you say you're on birth control. Do you use any other forms of protection?
We do use condoms, but I would really like to stop with the birth control altogether so I can get pregnant.
And how would your husband feel about that?
I'm not really sure. I think he'd be a little bit pissed off.
All right. You know, before stopping your birth control, this is a conversation you should have with your husband. How comfortable are you discussing your sexual problems with your partner?
I have no problem, so I guess I'll have to talk to him soon.
Okay. So does this means of birth control affect your level of pleasure?
Well, it's not the same as not using a condom, which is what I would prefer. And birth control doesn't have any bad side effects on me or anything. But I'd say sex is pretty pleasurable for the both of us.
Good to hear.
Mm-hmm.
Does this method bring any discomfort or produce undesirable effects?
No, not really.
And have you had any difficulty with fertility?
No, not that I'm aware of, because I got pregnant fairly easily in my previous marriage.
Describe your sexual feeling. How comfortable are you with your feminine side?
I'm very comfortable in my own skin, really. I'm 42, and I'm pretty happy with the way I look, and it's reassuring to know that my husband loves me for who I am.
Describe your level of satisfaction from your sexual relationship on a scale from 1 to 10. 10 being very satisfied.
Let's say I'm very satisfied with my sex life, but the use of a condom does impede it a little bit, I'd say, and bring the pleasure down. So I guess I'd give it an 8.
All right.
Approximately, yeah.
So, speaking of your husband, Greg, may I ask how old he is?
He's 44.
Okay. Could you explain any changes in your sexual relationship with him that you would like to make?
Well, as I just said, I would like to stop using condoms.
I see. So, have you experienced any pain or discomfort during intercourse?
No, I'm not.
And have you or your partner experienced any difficulty achieving an orgasm, maintaining an erection? If so, how has this affected your relationship?
Well, there haven't been any problems on my part, and I've never noticed him having a problem getting an erection.
Okay.
So, I don't think there's any problems.
Do you have any sexually transmitted diseases?
No, I don't think so. I hope not.
So you have not had any diseases such as gonorrhea, herpes, HIV, AIDS, chlamydial infections, venereal warts, or syphilis?
No, I haven't.
Alright, so we're pretty much done here. Do you have any other questions before we conclude the interview?
Well, do you think I'll be able to get pregnant?
I think this is a normal concern, and I think it will be better answered by your physician after she reviews our interview and any further lab work she may want to do. So, after wrapping everything up today, from my understanding, you are happily married, confident in your current health state, and looking to discuss the possibilities and challenges in getting pregnant with your husband. Does that sound about right?
I'd say that about sums it up.
All right, Susan. It was nice meeting you. Before you leave, here's a pamphlet on performing self-breast exams and where you can go to get an annual routine checkup. Have a nice day.
Thank you. You too.